Endometriosis. Symptoms and treatments. Endometriosis is a chronic condition where tissue similar to the lining inside the uterus, endometrium, grows outside the uterus, causing pain and other symptoms. It commonly affects the ovaries, fallopian tubes, and the tissue lining the pelvis. In rare cases, it can spread beyond the pelvic organs. Understanding the symptoms and available treatments is crucial for managing this often painful condition. Symptoms of endometriosis. The severity and type of symptoms can vary widely among individuals. Some women may experience mild symptoms, while others may have severe symptoms that significantly impact their quality of life. Common symptoms include pelvic pain. Chronic pelvic pain is the most common symptom of endometriosis. This pain can be severe and debilitating, often occurring before and during menstruation. Pain before and during periods, dysmenorrhea. Pain during or after sex, dyspareunia. Pain with bowel movements or urination, especially during menstrual periods. Chronic lower back and pelvic pain. Menstrual irregularities. Endometriosis can cause heavy menstrual bleeding, menorrhagia, or bleeding between periods, menometrorrhagia. Longer or heavier menstrual periods. Spotting or bleeding between periods. Infertility. Endometriosis is a leading cause of infertility. Up to 30 to 50% of women with endometriosis may experience difficulty conceiving. Difficulty getting pregnant despite regular, unprotected sex. Gastrointestinal symptoms. Endometriosis can affect the intestines, leading to gastrointestinal symptoms that may mimic other conditions like irritable bowel syndrome, IBS. Diarrhea, constipation, bloating, and nausea, particularly during menstruation. Other symptoms. Endometriosis can cause fatigue and other systemic symptoms. Chronic fatigue. Lower back pain. Pain during exercise. Diagnosis of endometriosis. Diagnosing endometriosis can be challenging, as symptoms often overlap with other conditions. A combination of medical history, physical examinations, imaging tests, and surgical procedures are used for diagnosis. Medical history and physical examination. Discuss symptoms, menstrual cycle patterns, and medical history with a healthcare provider. A pelvic exam may be performed to check for abnormalities such as cysts or scars behind the uterus. Imaging tests. Ultrasound can identify cysts associated with endometriosis, endometriomas. Magnetic resonance imaging, MRI, provides detailed images of the reproductive organs and other structures, useful for surgical planning. Laparoscopy. A minimally invasive surgical procedure where a small camera, laparoscope, is inserted into the pelvic cavity through a small incision. This allows the surgeon to directly visualize endometrial tissue and potentially remove it for biopsy. Laparoscopy is the gold standard for diagnosing endometriosis, as it provides a definitive diagnosis. Treatment options for endometriosis. Treatment for endometriosis aims to relieve symptoms, manage pain, and address fertility issues. Options include medication, hormone therapy, surgical interventions, and lifestyle changes. Pain management. Over-the-counter pain relievers. Nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, Advil, and naproxen, Aleve, can help reduce pain and inflammation. Hormone therapy. Hormone therapy aims to reduce or eliminate menstruation, which helps decrease endometrial growth and pain. Oral contraceptives. Birth control pills regulate hormones and reduce menstrual pain. Gonadotropin-releasing hormone, GnRH, agonists and antagonists. These medications lower estrogen levels, causing a temporary menopausal state and reducing endometrial tissue growth. Progestin therapy. Progestin-only medications, such as norethindrone acetate or the levonorgestrel intrauterine device, IUD, reduce menstrual flow and pain. Danazol suppresses the menstrual cycle by inhibiting the production of ovarian hormones, but has potential side effects. Surgical treatments. Laparoscopy. Used for diagnosis and treatment. The surgeon can remove endometrial implants, scar tissue, and adhesions. Ideal for women experiencing severe pain or fertility issues. Hysterectomy. Removal of the uterus, and sometimes the ovaries, oophorectomy, may be considered for severe cases when other treatments have failed and the woman does not wish to preserve fertility. Fertility treatment. Assisted reproductive technologies, ART. In vitro fertilization, IVF, may be recommended for women with endometriosis who have difficulty conceiving. Surgical intervention. Removing endometrial implants through laparoscopy can improve fertility chances. Lifestyle and home remedies. Dietary adjustments. Anti-inflammatory diet. Incorporate foods that reduce inflammation, such as fruits, vegetables, whole grains, nuts, seeds, and fatty fish. Limit red meat and processed foods. Reduce intake of red meat, processed foods, and refined sugars that can exacerbate inflammation. Regular exercise. Exercise releases endorphins, which are natural painkillers, and helps reduce estrogen levels. Aerobic exercises like walking, running, swimming, and cycling. Yoga and stretching exercises to improve flexibility and reduce pain. Stress management. Practice relaxation techniques such as deep breathing, meditation, and mindfulness to reduce stress and manage pain. Engage in hobbies, social activities, and support groups to help manage stress and improve overall well-being. Support and resources. Joining support groups can provide emotional support and practical advice from others experiencing similar challenges. Counseling and therapy. Professional counseling can help manage the emotional impact of endometriosis. Staying informed about the condition and treatment options empowers individuals to make informed decisions about their care. Endometriosis is a chronic condition that can cause significant pain and impact quality of life. Recognizing the symptoms and seeking timely diagnosis and treatment is crucial for managing the condition effectively. A combination of medical treatments, surgical interventions, lifestyle changes, and support can help individuals with endometriosis manage symptoms and improve their quality of life. If you suspect you have endometriosis or are experiencing symptoms, consult with a healthcare provider for proper evaluation and personalized treatment options. If you received value from this video, please like, subscribe and comment.